Today, we're going to be talking about how to correctly complete a MOTS reporting document. MOTS stands for Measures and Outcome Tracking System. Any client who receives any form of public funds to pay for their services with us is a mandatory MOTS report. So what are public funds? Public funds are any form of OHP. That could be Trillium, All Care, any of the CCOs that we contract with. The Department of Medical Assistance Program, which is the overseeing body for Oregon Healthcare. Any type of grant, ITRS, DPOT. The Probe 45s that come to us for our federal clients. Anyone who is receiving DUI treatment, and anyone who is on methadone replacement therapy. All of those client groups are mandatory MOTS reporting. So there are a few groups of clients who would not have to have MOTS submitted on them. That would be strictly cash pay who have not had a DUI or are not receiving DUI treatment. Private insurance with no OHP secondary payer and who do not have a grant or a sliding fee scale. The final group is our Bureau of Prisons contract client base. There aren't that many of them, but those individuals would not have any MOTS reporting done until they moved out of Bureau of Prison into a federal probation or parole slot. Why do we complete MOTS? And there are several reasons that we complete MOTS. The first of which is that when we accept public funds and provide services to clients using public funds, we have an agreement with the state of Oregon that we will provide them data about the treatment that we are providing so that they can determine whether the treatment we're providing is worthy of them allowing us to use state funds. It also determines the amount of county, state, and federal monies that we are given in any fiscal year. In fact, Buckley's funding, our detox center, is completely dependent on the MOTS reporting. The final reason that we complete MOTS, in my opinion, is probably the most important. The state of Oregon uses all the MOTS data that Willamette Family and all other substance abuse and mental health providers in the state of Oregon send them. They mine the data and they determine what is working, why it's working, and how to improve the delivery of services in the future. In the last 30 years, treatment has come a long way. It's very different than it was 30 years ago. And the reason is partly because of the data that's been submitted. All right, so now we know why we do it, who collects it, and why it's important. Let's talk about an actual submission document. Yay! Test client. We're going to go to the ECR. And as we're all familiar with, we open onto the client's face sheet. So the first thing we need to determine is how many programs are open for this client and do they have more than one episode? The reason that we need to know that is because we need to report our MOTS by the episode of care, not the program. So let's go client, clinical record, program history. And when we get there, we're going to look and we can see that the client opened at the Rapid Access Center on 3/22/19. They started in intensive day treatment. They moved up into men's residential, moved out of men's residential back into intensive day treatment, are currently in intensive outpatient, and have been receiving mental health services since the beginning of September. This is pretty much an average client. And when we look at this, we can see that this is all one episode. And the way we see that is by this number in this column. So now that we know this is one episode of care, we can open a MOTS document and begin our reporting. So when we're ready to open the document, we go Client, MOTS Data, and MOTS Submission Doc All. There is very rarely any time that you would use this assessment only. That's strictly there for me as I'm cleaning up files. So we open to this MOTS Profile Behavioral Health and Substance Abuse. If it is the first MOTS you're ever opening, this will be blank, and you will go directly to Add a MOTS Profile. Now this document is set up so that all programs can use it, meaning whether you're mental health, whether you're substance abuse, or whether you are detox services, the same document works for all. The only thing that is different between mental health and substance use is mental health reports end after the second module, MOTS Behavioral Health Data. So here we are on the first page of our MOTS document. As you can see at the top, it says Client Profile Data. It's just like every other service document we use. It has the information banner at the top, and it has the Edit Session Information link. You would click on Edit Session Information, select from your drop-down the program for which you are reporting. Since this is the first one, I'm going to select the rack and I'm going to submit. Now you can see that the client program has been set on the information banner. Now, I always do my documents starting from the top. So starting from the top, you can see that the very first line says MOTS documentation type. So this must be selected on every page. And because we are doing the first MOTS for this client episode, it is going to be a new one. There is only one new MOTS reporting document in the entire episode of care. Let me say that again because this is very important. There is only one new MOTS reporting document per episode of care. And the reason that is because you can't have a new submission in the middle of an episode. So if the client opens on March 22nd, 2019, but they open in another program on 3/25, that would still not be a new reporting document on 3/25. It would be a review of the existing reporting document. Okay, so we've selected new. It's the only new that's going to happen for this episode of care. I can't tell you how important that is. It's really, really important. Last name at birth populates from the client demographic. If there is no last name at birth selected in the demographic, it will automatically populate the last name that is in the client file, which is showing on the information banner. The prime number means OHP number. If there is no OHP, then you wouldn't have a number. If it's strictly a grant or cash pay DUI,